Welcome back. You're still watching SA Today, and we continue with our coverage of the coronavirus, and in particular as we lead up towards the President's address at the top of the hour. But South Africa is not the only country that's affected. It's landed on the continent, and we're getting updates from various parts of the continent. And we begin in Kenya now, which has announced that learning has been suspended in all learning institutions with effect from Monday, and this to avoid the spread of COVID-19. This follows the confirmation of 2 more positive cases of the deadly virus, bringing to 3 the total number of confirmed cases in the East African nation. Kenya confirmed its first case of COVID-19 on Friday, a 27-year-old woman who traveled from the US through London. Our correspondent in Kenya is Sarah Kimana. She joins us now on the line. Sarah, thanks very much indeed for joining us. So, 1 on Friday, and it's up to 3 now.
Yes, indeed. President Kenyatta making the announcement just a few minutes ago. He says out of the 27 cases that had been in contact with the index case, we now have 2 more positive cases, bringing the positive cases in Kenya to 3. And so now the country is taking very drastic measures, which include closing all learning institutions beginning tomorrow, an exercise that should be concluded by Friday when all universities should have shut their doors. President Kenyatta has also announced the suspension of all public gatherings, whether funerals, weddings, church services, and he's also said that weddings and funerals should be limited to just the close family members of the person who's either passed on or the person who is getting married. In terms of work, he's asked companies to be able to only conduct businesses when it is necessary, but they're also asking that most of those who are working to consider working from home, and employers to consider giving their employees permission to work from home. Interestingly, Kenya also deciding that they will be limiting the use of cash. President Kenyatta announcing that they will be encouraging Kenyans to go cashless, whether use mobile money transfer services, popularly known as M-Pesa here in Kenya, or plastic money in form of credit cards or debit cards. This, they say, will limit the handling of money, which the World Health Organization has incidentally said could also be spreading coronavirus.
These measures will have quite an effect on the daily lives of Kenyans. Have you started to see a sense of reaction in terms of what's been announced by the President, perhaps on social media?
Not just see, I have felt it. This morning, I attended a service at the Catholic Church where I worship, and it was clear that things have changed. In a church where we are almost 600 every day, every Sunday, this time we were reduced to just about 100, and a lot of people keeping their distance. And indeed, the priest kept reminding us that there is COVID-19 already in the country, and that we are taking measures to prevent the spread of the disease. For example, at the entrance of the Catholic Church, there's usually holy water that had been removed, and in its place we had hand sanitizers. Inside the church, we were not allowed to offer each other a sign of peace. Instead, we waved at each other. And then, most probably interestingly, or maybe when a win for Kenya, they sent the local administrators, chiefs, to every church to address the gatherings, to address those who are in church, to speak to them about coronavirus and what the government is doing and what worshippers should be doing. Oh, also interestingly, the sacrament, the Holy Communion, was not offered into the mouth, from the hand of the priest into the mouth, but people were given by hand. The other interesting thing that we have noticed is that there is panic shopping already. When the first case was announced, shopping malls have been full. People buying everything that they need, that they think they will need, but also buying off hand sanitizers and toilet paper off the shelves.
There's quite a lot of movement of people in the East African community, and I wonder, is this going to shift? Is this going to change? What are you hearing about the measures being taken by neighboring states?
Rwanda, which also announced one case on Friday, has also taken similar measures as Kenya. Indeed, the minute they announced that they had one positive case, President Kagame and the Ministry of Health announced the closure of learning institutions. They announced the end of public gatherings, including churches, weddings, no clubbing. So they took immediate drastic measures. Ethiopia has just announced another 4 positive cases, bringing the cases in Ethiopia to 5 now. We still have not had a lot in terms of limiting movement in Ethiopia. Ethiopian Airways is still flying in and out of Ethiopia, and across the world, it travels to more than 150 destinations. It is still going to all those destinations. So we have not had yet from Ethiopian Airlines if it will be limiting that movement. Several other countries in the region, including the Democratic Republic of Congo, the Central African Republic, have all said that they have confirmed 1 case each. And so the region is actually on high alert. Uganda and Tanzania have also taken drastic measures limiting movement into the country of people coming from countries that are now said to be hotspots of the disease. In Uganda, anybody who's coming from Europe has to take mandatory quarantine of 14 days at their own expense. In fact, the country is saying they're discouraging movement from Europe into Uganda. Tanzania also limiting movement and asking for self-isolation for those who come into the country from the epicenters of the disease.
How much do we know about what's happening in the Horn of Africa, Sarah?
Sadly, a lot of information not coming from Somalia, but we know last evening that the government of Somalia also announced that it would be limiting movement of persons from Europe. And important because a lot of Somalis are actually dual citizens. You find most of them are either UK Somali, Canadian Somali, American Somali. So the government of Somalia is saying that it is also limiting that movement. Sadly, it will be impossible to tell what is happening in the central part of the country where the Al-Shabaab still takes control and has a hold over that part of the nation.
Coming back to your country in Kenya, what do we know about the 3 people that have tested positive? Again, we know one was a traveler. What about the other 2?
Well, we understand that the other person is a close relative. Some people indicating that the person is very close to index case 1. The other 2 were also living in the same house where she was hosted. Just to give more of what has happened in the area where the lady spent the night just before she reported that she was not feeling well. Government yesterday sent health officials who fumigated the whole apartment block, which incidentally is very big. It could be having plus or minus 100 people who live there. So that is probably the reason why the government is on very high alert. And the area is called Rongai, is very populous. And it is people who will, on a day-to-day basis, use public transportation. Maybe the reason why the government is moving very fast to limit movement, not just in Rongai, but across the country, because most people who work inside the city of Nairobi will live as far as that place called Rongai, where this lady was sheltering.
The health minister working hard to try and tell people not to panic, but as you were saying, a lot of panic buying taking place already. What kind of messaging has been coming through from the authorities over time? I know that there was a drill planned as late as Thursday in preparation. Is that an indicator of how well prepared Kenya has been?
Well, being very central and having had an influenza department, a department of influenza control, Kenya seemed to have been very well prepared. Indeed, a lot of the trainings that were carried out by the Africa CDC and the World Health Organization before the disease got into this part of the region were conducted in Kenya. And so in terms of preparation, it seemed like Kenya was very well prepared. But that has still not reassured Kenyans. The government tried to send mass text messages. They only managed to send 2. We still do not understand why that stopped. But they have the Minister of Health, who is incidentally very new into the job, has tried to give its regular updates and allow media to ask questions and to probe. So that has at least made it possible for people to at least relax a bit. However, there is a lot of spread of false and fake news on social media, and government is finding itself having to try and move a step ahead of fake news that is circulating on social media. For example, yesterday there was a video of a lady which was circulating saying that indeed she did not have COVID-19 and saying that she had traveled into Kenya from the U.S. And this made people think that the government was actually lying, that there still was no positive case. I think another thing that may be impressive is the issue of sending health personnel and administrators to the level of the chief in churches today, and we'll also be conducting door-to-door trainings on hygiene, personal hygiene. So these are issues that maybe will bring the government closer to the people and probably reassure them that indeed the government is doing its best. This region, incidentally, has been very prepared, not just for COVID-19, but because for the longest time, since the outbreak of Ebola, there have been surveillance measures at the airport. It is a region that is probably best prepared to deal with this, because any time you're getting into the country from the airport, we have had our temperatures taken for more than 2 years now. We have filled forms which indicate where you're coming from, who did you sit next to on the plane. So all that tracing has been happening for some time now. Maybe it was a preparation for COVID-19, who knows?
All right, Sarah, that's where we're going to leave it for the time being. Thanks very much indeed for that update. That's our correspondent from Nairobi in Kenya.